Introduction of Dependent Personality Disorder. Dependent Personality Disorder (DPD) is a type of anxious personality disorder. People with DPD often feel helpless, submissive, or incapable of taking care of themselves. They may have trouble making simple decisions, but with help, someone with dependent personality can learn self-confidence and self-reliance. Individuals with dependent personality disorder sometimes agree with other people when their own opinions differ so as not to be rejected. Their desire to obtain and maintain supportive and nurturing relationships may lead to their other behavioral characteristics, including submissiveness, timidity, and passivity. People with this disorder are similar to those with avoidant personality disorder in their feeling of inadequacy, sensitivity to criticism, and need for reassurance. However, people with avoidant personality disorder respond to this feeling by avoiding relationships, whereas those with dependent personality disorder respond by clinging to. It is important to note that in certain cultures, dependence and submissions may be viewed as a desired interpersonal state. People with DPD have an overwhelming need to have others take care of them. Often, a person with DPD relies on people close to them for their emotional or physical needs. Others may describe them as needy or clingy. Prevalence or statistic of dependent personality disorder. Data from 2001 until 2002 National Epidemiology Survey on Alcohol and Related Conditions yield estimate prevalence of dependent personality disorder of 0.49% and dependent personality was estimated. Based on probability subsample from Part 2 of the National Comorbidity Survey replication to be 0.6%. Statistics show that roughly 10% of adults have a personality disorder. Less than 1% of adults meet the criteria for DPD. More women than men tend to have DPD. Sign of dependent personality disorder. Someone with dependent personality disorder may have several symptoms, including avoidance of personal responsibility, difficulty being alone, fear of abandonment and sense of helplessness when relationships end, oversensitivity to criticism, pessimism and lack of self-confidence, and the last one is trouble making everyday decisions. On development, expert has found dependent personality disorder is more likely in people with particular life experience, including number 1, abusive relationship, people who have a history of diagnosis. Number 2, childhood trauma. Children who have experienced child abuse, including verbal abuse or neglect, may develop dependent personality disorder. It may also affect people who experience a life-threatening illness during childhood. On causes. We are all born dependent on other people for food, physical protection, and nutrients. Part of the socialization process is most culture enveloped, helping us live independently. It was thought that such description as early death of a parent of neglect or rejection by caregiver could cause people to grow up fearing abandonment. It also is clear, however, that genetic influence are important to development of this disorder. What is not yet understood are the physical factors underlying this genetic influence and their way they interact with environmental influences. First, family history. Someone with a family member who has DPD or another anxiety disorder may be more likely to have DPD diagnosis. Number 2, certain culture and religious family behaviors. Some people may develop DPD due to culture or religious practice that emphasize reliance on authority. But passivity or politeness alone is not a sign of DPD. On risk, people with dependent personality disorder are at risk for depression, anxiety disorder, and phobia, as well as substance abuse. They are also at risk for being abused because they might find themselves willing to do virtually anything to maintain the relationship with dominant partner or person of authority. Prognostic factor. People with dependent personality disorder may believe they can't take care of themselves. They may have trouble making everyday decisions such as what to wear without other reassurance. Diagnostic criteria. Has difficulty making everyday decisions without an excessive amount of advice and reassurance from others. Number 2, need others to assume responsibility for most major area of his or her life. Number 3, has difficulty expressing disagreement with others because of fear of loss of support or approval. Number 4, has difficulty initiating projects or doing things on his or her own. Number 5, goes to excessive length to obtain nutrients and support from others, to the point of volunteering to do things that are unpleasant. Number 6, feel uncomfortable or helpless when alone because of anger, fears of being unable to care of himself or herself. Number 7, urgently seek another relationship as a source of care and support when a close relationship ends. And the last one is unrealistically preoccupied with fear of being left to take care of himself or herself. Proposed strategy to help. The treatment for this disorder is mostly descriptive. Little research exists to show whether a particular treatment is effective. On the surface, because of their attentiveness and eagerness to give responsibility for their problem to the therapist, people with dependent personality disorder can appear to be ideal patients. That very submissiveness, however, negates of one of the major goals of therapy, which is to make the person more independent and personally responsible. Therapy, therefore, progresses gradually as a patient develops confidence in his ability to make decisions independently. There is a particular need for care the patient does not become overly dependent on the therapist. Someone with DPD can live an emotionally healthy life if they receive treatment from a mental health provider. Learning new ways to cope with difficult situations can make a difference in their overall outlook. People who don't get treatment may be at risk for depression and anxiety. Without treatment, a person may misuse substance and develop problems such as drug addiction or alcoholism. Without treatment, people are more likely to stay in unhealthy or abusive relationships. Last but not least, let's work together to ensure that this personality will get the best treatment. Thank you.